Hi, everyone. I'm Dr. Reena Malik, urologist and pelvic surgeon, and welcome back to the Reena Malik MD podcast. Today, I want to talk about something that every woman will experience at some point in her life, a change so universal, yet so often misunderstood or even silenced. I'm talking about menopause and the ways it can affect not just our hormones, but our relationships, our comfort, and our confidence. This conversation is deeply personal to so many women. And if you're listening right now and nodding along, know this. You are not alone. What's happening to your body is not strange. It's not shameful, and it's not something you have to just put up with. It's your body changing, adapting, and reminding you that you are human strong and still entirely capable of feeling like yourself again. So let's start with what really happens when our bodies begin this transition. Menopause doesn't happen overnight. It's a gradual process, a hormonal shift that can start up to 10 years before your last period. On average, menopause occurs around age 51. But the perimenopausal changes, those early fluctuations in estrogen and progesterone, can begin in your 40s or even your late 30s. You might still have regular cycles, or maybe they become unpredictable, some months heavier, some months lighter. And along with that, you might start noticing changes you can't quite explain. Maybe your skin feels drier. Maybe your sleep feels different. Maybe sex doesn't feel the same as it used to. And this is where the conversation about vaginal dryness often begins. Now, vaginal dryness is something that can sneak up on women. It's not something you wake up with one day, but more of a gradual change that becomes noticeable over time. You might start to feel a little discomfort during sex, or maybe even burning or itching afterwards. Sometimes it's mild and you think it'll pass. Other times it becomes so uncomfortable that you start avoiding intimacy altogether, not because you don't love your partner, not because you aren't aroused, but because your body simply doesn't feel ready. I've heard so many women say, I still want sex, but it hurts, or my partner thinks I'm not into it anymore. And the truth is, it's not about desire, it's about biology. You see, estrogen plays a huge role in keeping the vaginal and vulvar tissues healthy. It maintains blood flow elasticity and moisture. When estrogen levels start to drop, which they do during perimenopause and menopause, those tissues begin to thin. The glands that produce natural lubrication don't work as efficiently, and that can make sex feel uncomfortable, even painful. This isn't something that's your head. It's real, it's physical, and it affects roughly 80% of women after menopause at some point in their lives. The medical term for this is genitourinary syndrome of menopause, but what that really means is a set of symptoms: dryness, irritation, sometimes urinary frequency, all related to that loss of estrogen in the tissues. Now, the good news is that there are options. You don't have to just live with this. There are ways to make intimacy comfortable again, and most importantly, to make you feel at home in your body once more. The first and simplest step is lubricants. I know it might sound basic, but the right lubricant can make a huge difference. Water-based lubricants are the most common. You'll find them in most stores, and they're safe for almost everyone. They feel natural, they're easy to clean, and they don't interfere with condoms or toys. The only catch is they can dry out fairly quickly, so you may need to reapply during sex. That's totally normal. Think of it as a part of the process, not a disruption. Silicone-based lubricants, on the other hand, last longer. They're more slippery, they don't evaporate, and they're a favorite for many people who struggle with dryness. They can feel silky and smooth. A lot of couples love that. The only thing to remember is that silicone lubricants shouldn't be used with silicone-based toys because they can break them down. Otherwise, they're a great option for longevity and comfort. Then there are oil-based lubricants, things like coconut oil or olive oil-based products. They can feel amazing and they last a long time, but they can stain sheets and, importantly, shouldn't be used with condoms because oil can degrade latex. If lubricants don't fully address the problem, the next step is vaginal moisturizers. Now, I love to compare these to facial moisturizers. They work the same way. Just like you wouldn't wait for your face to feel dry before applying a moisturizer, vaginal moisturizers help keep the tissues hydrated regularly, not just during sex. They often contain soothing, hydrating ingredients like hyaluronic acid. You can use them daily or every few days, depending on your comfort level. They're available over the counter and can make a huge difference in your everyday comfort. But for many women, especially as estrogen levels continue to drop, these topical solutions might not be enough. That's when we start to talk about vaginal estrogen therapy. And I cannot stress enough how transformative this can be. Vaginal estrogen directly targets the tissues that are affected by low estrogen levels. It restores blood flow, thickness, and natural lubrication. It can come in a few different forms: cream, suppositories, or a ring that you place inside the vagina, which releases a steady dose of estrogen and stays in place for about 3 months. Here's the key thing I want you to remember: vaginal estrogen is local. That means it acts right where you need it, in the vaginal tissues, with minimal absorption into the bloodstream. It's incredibly safe. There's no evidence linking vaginal estrogen to breast cancer, ovarian cancer, or other systemic hormonal effects that many people worry about. In fact, it's one of the safest and most effective treatments we have for menopause-related vaginal symptoms. I often tell my patients, you can use this from the time you start having symptoms till death do you part. That's how safe it is, and the improvement it brings, remarkable. Women often tell me, I feel like myself again. And that's exactly what we want to bring back comfort, confidence, and connection. It's also really important to involve your partner in this conversation. So many couples silently struggle through this phase because neither person knows how to talk about it. Women might feel embarrassed to bring up dryness or pain, and men might think their partner has lost interest or attraction. But this isn't about desire or attraction. It's about hormonal changes that are completely natural. I often tell partners, show empathy, be curious, and be supportive. If you're the partner hearing this, maybe consider picking up some lubricants or moisturizers or suggesting you both explore these together. That small gesture of care and understanding can go such a long way in preserving intimacy and trust. Menopause and its symptoms aren't a sign that something is wrong with you. They're a sign that your body is evolving, and with the right tools, you can move through this chapter with grace and comfort. The conversation around vaginal health shouldn't be one of silence or embarrassment. It should be one of empowerment. We talk about skincare. We talk about nutrition. We talk about fitness. Vaginal health deserves that same openness and care. When you take charge of your comfort, you're not just improving your physical well-being, you're reclaiming ownership of your body and your relationships. As we move forward, I also want to touch on something that can sometimes be confusing for women in the same age group. When you start noticing changes in your urine, maybe you notice your urine looks a little pink or reddish, and you're wondering if that's normal. Let's talk about that next, because while menopause-related changes are natural, pink urine, or what we call hematuria, is not something to ignore. Perfect. Here's S part 2, approx 2,000 words F, the continuation and completion of your full 4,000-word rewritten speech. And as Dr. Reena Malik's natural, compassionate, and educational voice, seamlessly following part 1 to part 2, rewritten speeches. When you see pink in your urine, it's easy to think maybe it's nothing. Maybe I'm dehydrated or had too much beet juice. But I want to pause here and be really clear. If your urine looks pink, red, or even tea-colored, it's not something to wait and see about. Blood in the urine, or what we call hematuria, is a signal from your body that something might be going on, and it deserves your attention. Now, not all causes of blood in the urine are dangerous. Sometimes it can be as simple as a urinary tract infection. You might have burning when you pee, urgency, or frequency, and when we treat the infection, the blood disappears. But other times, blood in the urine can be the only sign of something more serious, like a kidney stone, or more rarely a tumor in the bladder or kidneys. The key point here is that we don't know until we look. And in medicine, when something could be serious, we always err on the side of caution. So what should you do if you notice blood in your urine? The first step is to see your doctor. Ideally, your primary care physician or a urologist. They'll start with a urinalysis, which checks for red blood cells in the urine and looks for signs of infection. If there's bacteria, we'll treat it, and then we'll recheck your urine afterward to make sure the blood is truly gone. That step is important. Sometimes people stop after antibiotics, but follow-up is crucial. Be sure there's nothing lingering beneath the surface. The next step, depending on your situation, might be imaging of your kidneys and urinary tract. This can be done with an ultrasound or a CT scan. These tests help us see if there are stones, masses, or structural issues that might be causing bleeding. For some patients, especially if they're older or have certain risk factors like smoking, chemical exposures, or a family history of bladder or kidney cancer, we may recommend a cystoscopy. Now, a cystoscopy sounds intimidating, but it's a simple outpatient procedure where we use a small camera to look inside the bladder. It's quick, and it's the best way to actually see what's going on. I often get asked, why can't you just do an MRI or CT scan instead? And the answer is, no scan can show the inside of the bladder with the same accuracy. The bladder changes shape all the time. It expands and contracts depending on how full it is. Imaging might miss small lesions or confuse folds in the bladder for something else. The cystoscopy gives us direct visualization, which is the gold standard for making sure we're not missing anything serious. I also want to reassure you, in most cases, when we investigate blood in the urine, we don't find anything life-threatening. In fact, in about 85% of cases, we don't find a clear cause. Sometimes it's due to irritation, mild inflammation, or something as simple as friction from exercise. But the reason we look so thoroughly is because in that other 15%, there could be something important, something we can catch early and treat effectively. And that's the beauty of modern medicine. If you catch things early, you can make a huge difference in outcomes. One thing I've seen often, especially among women, is that they'll downplay symptoms. They'll think, I don't want to bother anyone, or it'll probably go away, but your health deserves the same urgency and care you'd give to someone you love. If your child or partner had blood in their urine, you wouldn't wait. You take them in, give yourself that same compassion, that same care, because your body is speaking to you and you deserve to listen. Now, speaking of the urinary system, let's talk about something that many people have heard of but don't fully understand: kidney stones. Just hearing the words makes people cringe. and with good reason. Passing a kidney stone is often described as one of the most painful experiences a person can go through, and while many assume it's something that only happens to men, I want to set the record straight. Women get kidney stones too. In fact, the gap between men and women when it comes to kidney stones has been narrowing over the years. So what are kidney stones? They're essentially hard deposits that form when minerals in your urine become too concentrated and crystallized. Think of it like sugar crystallizing at the bottom of a syrup bottle when it gets too thick. The same thing happens in your kidneys when there isn't enough fluid to keep those minerals dissolved. Over time, those tiny crystals can grow and clump together, forming stones that can block the flow of urine and cause intense pain. If you've ever seen someone in the emergency room with a kidney stone, you know exactly what I mean. They can't get comfortable. They're pacing, sweating, sometimes vomiting from the pain. It's excruciating. And yet kidney stones are preventable for many people, especially if we know the cause. There are several factors that increase your risk. Family history is a big one. If your parent or sibling has had kidney stones, your risk goes up significantly. But lifestyle factors matter too. Dehydration is probably the most common culprit. We often underestimate how much fluid our bodies really need. You should be drinking enough water that your urine is light yellow, almost clear. On average, that means about 2 to 3 liters of fluid a day, more if you live in a hot climate or are physically active. Water helps dilute the substances in your urine that can form stones like calcium, oxalate, and uric acid. Diet plays a huge role as well. People often assume they should avoid calcium if they've had kidney stones, but that's actually a misconception. Most stones are calcium-based, yes, but it's not the calcium you eat that's the problem. It's the calcium that combines with oxalate in your urine. In fact, getting too little calcium can actually increase your risk because dietary calcium binds to oxalate in your intestines and prevents it from being absorbed into your bloodstream. So the goal is balance. Don't overdo calcium supplements, but don't avoid calcium-rich foods either. On the other hand, you do want to be mindful of oxalate-rich foods. These include things like spinach, kale, beets, nuts, and rhubarb. You don't have to cut them out completely. These foods are healthy in many other ways, but if you're prone to stones, moderation is key. Eating them with calcium sources like yogurt or milk can actually help neutralize the oxalate. Salt intake is another big factor. High sodium in your diet increases calcium levels in your urine, which can promote stone formation. So cutting back on processed foods, fast food, and excessive table salt can go a long way. Similarly, too much animal protein like red meat, poultry, and seafood can increase uric acid in your urine, making stones more likely. And then there's something most people never think about, citrate. Citrate is a natural inhibitor of kidney stones. It binds to calcium and prevents it from forming crystals. You can get more citrate through fruits and vegetables, especially citrus fruits like lemons, limes, and oranges. Even drinks like Crystal Light lemonade have a lot of citrate and can help make your urine less likely to form stones. I often tell my patients, squeeze some lemon into your water, not just for taste, but for your kidneys. Now, if you do have a family history of kidney stones or you've had one before, it's important to get a proper evaluation. A urologist can order a 24-hour urine test to see exactly what's going on with your metabolism, what minerals or chemicals are out of balance, and tailor a plan specifically for you. Sometimes it's a matter of adjusting diet. Other times, medications may help prevent recurrence. The key is understanding your body's chemistry so you can prevent future pain and complications. Kidney stones can also serve as a wake-up call, a reminder that small daily choices add up. Staying hydrated, balancing your diet, and paying attention to your body can make a huge difference in your long-term urinary health. And this ties into something I always emphasize to my audience. Your health isn't something to manage only when something goes wrong. It's a lifelong relationship. The more you listen to your body, the more curious you are about what it's telling you, the better you can care for yourself. When I think about these 3 topics, vaginal dryness and menopause, blood in the urine, and kidney stones, they might sound separate issues, but they're all connected by one central truth: awareness and action save us from unnecessary suffering. Too often, women are told to tolerate discomfort, to normalize pain, or to put everyone else's needs before their own. But every symptom your body gives you, whether it's dryness, bleeding, or pain, is a message. It's your body asking for care, not silence. And that's the biggest takeaway I want to leave you with today. You deserve to feel good in your body at every age. You deserve to enjoy intimacy, to move without pain, to live without fear or shame about what's happening inside you. These aren't just women's issues. They're health issues. They're human issues. When you take the time to address them, you're not just improving your quality of life, you're reclaiming your sense of self. Menopause doesn't mark an ending. It marks a transition, a new phase of your body's wisdom. Seeing blood in your urine isn't a reason for panic. It's an opportunity for early intervention and peace of mind. And kidney stones, they're not a life sentence. They're a reminder of how powerful prevention can be. Every piece of information you take from conversations like this is a tool to advocate for yourself, to talk to your doctor confidently, and to make choices that align with your long-term health. So if you've been waiting to make that appointment, to ask that question, to take that first step toward feeling better, this is your sign. Your health is worth your time, your comfort is worth your effort, and your peace of mind is worth every conversation, every test, and every ounce of attention you give to yourself. I want to thank you all for spending this time with me today. I know these topics can be deeply personal and sometimes even uncomfortable to talk about, but I promise you, the more we bring them into the open, the more we can replace fear and confusion with clarity and confidence. Our bodies are incredible, resilient, and deserving of care at every stage of life. If you found this conversation helpful, I invite you to continue learning and exploring. There are so many tools and resources available now, from lubricants and moisturizers to safe hormone therapies, from preventive kidney stone plans to simple hydration habits that can change your life. Knowledge is power, but action is healing. I'm Dr. Reena Malik, urologist and pelvic surgeon, and as always, thank you for trusting me to be part of your journey toward better health. Remember to take care of yourself because you are absolutely worth it. Perfect. Here is part 2, the final 2,000 words of your full 4,000-word speech written naturally in Dr. Reena Malik's engaging, compassionate, and educational tone. This section continues from the menopause and estrogen therapy discussion and flows all the way through hematuria, kidney stone awareness, lifestyle insights, and an inspiring closing message. When you notice even a hint of pink or red in your urine, your first thought might be, maybe it's something I ate. And sometimes, yes, foods like beets or blackberries can tint urine slightly red. But if that color lingers or deepens, please don't brush it off. Blood in the urine, what we call hematuria, isn't always painful, but it's always worth investigating. It might be something as simple as a small infection or a stone passing, but it can also be the first sign of something more serious, like a kidney or bladder problem. I've had countless patients tell me it only happened once, so I ignored it. And weeks later, when we finally do imaging or a urine test, we find something that could have been caught much earlier. Let's talk about why hematuria happens. Inside your urinary tract, your kidneys, ureters, bladder, and urethra, there are delicate blood vessels. When they get irritated or injured, blood can leak into the urine. One of the most common causes is a urinary tract infection. The lining of the bladder becomes inflamed and small capillaries leak tiny amounts of blood. Usually, it's accompanied by other symptoms like burning when you pee, needing to go more often, or that constant, I have to go again, feeling. A simple urine test and antibiotics can clear it up quickly. But sometimes the cause isn't an infection, it's a kidney stone. Kidney stones form when minerals in the urine, like calcium or uric acid, crystallize and clump together. They can be as small as a grain of sand or as large as a golf ball, and when they start to move through the urinary tract, that's when the pain hits. If you've ever experienced it, you know exactly what I mean. It's an intense, sharp pain that can radiate from your side to your groin, sometimes with nausea or vomiting. And yes, stones can cause blood in the urine because they scrape the lining of the urinary tract as they pass. When I see a patient with blood in the urine, one of my first priorities is to rule out cancer of the bladder or kidney. I know that sounds frightening, but this is exactly why I emphasize early evaluation. Bladder cancer, when caught early, is often highly treatable. The key is not to ignore symptoms just because they come and go. Even if you only saw blood once, even if it didn't hurt, get it checked. A simple ultrasound or CT scan can give us clarity and peace of mind. There's another subtle link between menopause and urinary changes that I want to highlight. As estrogen declines, the tissues of the bladder and urethra also thin and become more fragile, just like the vaginal tissue. This can make women more prone to infections, irritation, or even small amounts of bleeding. So sometimes what seems alarming might actually be a result of that same hormonal transition we talked about earlier. Still, it's always worth confirming. Never assume it's just hormones until we've ruled out other causes. Now let's talk about kidney stones in a bit more detail, because this is something that affects both men and women, and we're seeing it happen more frequently across all ages. One of the biggest risk factors for kidney stones is dehydration. When you don't drink enough water, your urine becomes concentrated, meaning there's less fluid and more minerals. Those minerals start to stick together and form crystals. Over time, those crystals can grow into stones. So one of the most powerful, simplest ways to prevent kidney stones is just to stay hydrated. I usually tell my patients your urine should be light yellow or almost clear. If it's dark yellow, that's your body's way of telling you, hey, I need more water. On average, aim for at least 2 to 3 liters a day, depending on your size, activity level, and how much you sweat. But hydration alone isn't the whole story. Diet plays a major role too. A lot of people think if my stone was made of calcium, I should avoid calcium, but that's actually not the case. When you cut out calcium completely, your body absorbs more oxalate, the other major stone forming mineral, which can make stones more likely. Instead of avoiding calcium, focus on balance. Eat calcium-rich foods like yogurt or leafy greens with meals, because dietary calcium actually helps bind oxalate in the gut, preventing it from reaching the kidneys. Another big dietary factor is salt. Too much sodium increases calcium in the urine, which can contribute to stone formation. So try to limit processed foods, fast food, and even some sauces or snacks that are high in salt. Aim for home-cooked meals when possible. Your kidneys will thank you for it. And then there's protein. We need it, but high protein diets, especially those heavy in red meat, can increase uric acid levels, making stones more likely. That doesn't mean you have to become vegetarian, but try to get a balance. Lean proteins like fish, eggs, and plant-based options can help. Small lifestyle adjustments like these can have a massive impact over time. I also want to talk about family history for a moment. If you have a parent or sibling who has had kidney stones, your risk automatically increases. There's a genetic component and understanding that helps you take preventive action early. For those with recurrent stones, we often do metabolic evaluations, simple 24-hour urine tests that tell us exactly which minerals are too high or too low. From there, we tailor the diet or prescribe medications that reduce stone formation. That's personalized medicine in action. And while we're talking about prevention, let's zoom out for a second. Many of the things that help your urinary system also benefit your overall health: staying hydrated, eating a balanced diet, keeping sodium low, and staying physically active. Movement helps keep your kidneys functioning efficiently and supports circulation everywhere else. There's a deep connection between how we treat our bodies and how they respond over decades. What's fascinating, and something I always share with my audience, is that many women are conditioned to ignore their symptoms. They take care of everyone else first, their kids, their parents, their partner, and put themselves last. They'll notice burning with urination or dryness or discomfort, but think, it's not that bad, I'll deal with it later. And that later often turns into months or years. So if you take away one message from me today, let it be this: your discomfort deserves attention. Your symptoms matter. Listening to your body isn't selfish, it's smart. Every time I see a woman finally seek help after years of silence, I see the same pattern of emotion, relief, validation, and then empowerment. Because once you understand what's happening inside your body, you realize it's not something mysterious or shameful. It's something manageable. Whether it's through hydration, dietary changes, medication, or hormonal support, there's almost always a path forward. I remember one of my patients, a 6-year-old teacher who came in embarrassed to even mention her symptoms. She'd been experiencing pain during sex for over 3 years and thought it was just age. When I suggested a simple vaginal estrogen regimen, she was hesitant. A few weeks later, she came back almost in tears, not from sadness, but from relief. She told me, "I feel like I got a part of myself back." That's what this work is about, helping women rediscover comfort, confidence, and intimacy with themselves and their partners. For kidney stones, I've seen similar transformations. A young man who was chronically dehydrated and addicted to energy drinks came in with his third stone in 2 years. We talked about lifestyle, water intake, and cutting back on certain foods. When he came back a year later, stone-free, he said, "I didn't realize how small habits were wrecking my kidneys." Awareness is everything. You don't have to overhaul your life. You just need to make small, consistent choices. When it comes to prevention, I also emphasize the importance of regular checkups. Even if you feel fine, an annual physical and basic urine test can catch small changes before they become problems. Think of it as maintenance. The same way you maintain your car, you wouldn't wait for smoke to come out of the engine for getting an oil change, right? Your body deserves that same proactive care. Now, if we step back and look at the bigger picture, these topics, menopause, dryness, stones, blood in the urine, they all connect through one central truth: our bodies are always communicating with us. Pain, dryness, fatigue, or discomfort, they're all signals, not punishments. They're your body's way of saying, I need attention here. And when we learn to listen rather than ignore, that's when real healing begins. The challenge is that society hasn't always given women the language or the permission to talk about these things. We're taught to be discreet, polite, to not make it awkward. But what's really awkward is living with preventable pain. What's truly unnecessary is the shame that keeps people silent. Talking about pelvic health, bladder changes, or vaginal comfort doesn't make you less feminine. It makes you informed. It makes you empowered. So today, whether you're listening as a woman going through menopause, a younger woman curious about what's ahead, or a partner trying to understand what your loved one is experiencing, remember this: empathy and education go hand in hand. The more we talk about these things openly, the easier it becomes for everyone. If you're dealing with vaginal dryness, try a moisturizer or lubricant. If that's not enough, talk to your doctor about local estrogen therapy. If you've seen blood in your urine, don't wait, get it checked. If you've had kidney stones before, ask for a prevention plan instead of waiting for the next episode. Small steps today prevent big problems tomorrow. And here's something I really want you to take with you: health isn't about being perfect. It's about being proactive. It's not about never having symptoms. It's about responding to them with awareness and compassion rather than fear or shame. As women, our bodies carry us through so many transitions: puberty, pregnancy, motherhood, menopause, and everything in between. Each stage brings changes that challenge us, but they also teach us resilience. The more we honor those changes, the more connected we feel to ourselves. To every woman listening right now who has felt unseen, unheard, or dismissed, please hear this from me directly. Your pain is real, your experience is valid, and your comfort is worth fighting for. Don't minimize it. Don't hide it. Find a healthcare provider who listens, who explains, who empowers you with options instead of judgment, because when you reclaim your health, you reclaim your power. You start living again, not just surviving. You laugh more, move more freely, and connect more deeply. That's not vanity, that's vitality. So tonight, drink a glass of water for your kidneys. Schedule that checkup you've been putting off. Talk to your partner about what you've learned today. Try that lubricant or ask your doctor about estrogen cream. Take one small, gentle action toward yourself. That's how change begins. I always tell my patients the goal isn't to feel younger, it's to feel whole, to feel like yourself again. Menopause isn't an ending, it's an evolution. Blood in the urine isn't a curse, it's a message. And every time you listen, you become a little stronger, a little wiser, and a lot more in tune with your body. Thank you for spending this time with me today, for allowing me to be part of your journey, and for caring enough about yourself to listen. Remember, awareness is power, and when you choose to act on that awareness, you change not only your health, but your quality of life. Until next time, I'm Dr. Reena Malik, reminding you to stay curious, stay compassionate, and above all, stay connected to your body and to yourself. Take care, be kind to your body, and as always, thank you for listening.